Did you know that 50 million people worldwide have dementia? And they're expected within the next 30 years to be 132 million people. Hi, I'm Trish Gleason. And today we have with us Dr. Kelly Miller, and he's going to get busy and teach us how to reverse dementia. Hi, Dr. Miller. How are you?
Hi, Trish. Good afternoon. Thanks for
Good.
having
Well,
me.
so excited to hear what you've got to say. So those are pretty staggering numbers I just gave. So can you give us some insight on what we can do to reverse dementia? I'll turn it over to you.
Absolutely. Really, tell you about my story. The reason I got interested in brain is because I was in my mid 50s and I just knew I was having problems not remembering things. I used to have my schedule in my head. I never forgot things, and I was starting to um, having to go back and look in the textbook for things that I've been, the definitions of for 20 or 30 years. Something was definitely wrong. And in my history, I had multiple car crashes, but I also played rugby for over 20 years. And I played a position where I either ran the ball and got tackled almost, a lot, or I tackled someone a lot. So I probably was involved in 10,000 tackles in 20 years. Just a lot of repetitive head trauma, I think, was the cause of it. So I started searching for some solutions for myself. So that's the reason I wrote the book, and that's what I devote my practice to now.
Well, show us your book. And so this whole book is about your brain and reversing dementia. And
Right. So this book is about a global approach. These are all things that, in my research, that I found that were all natural. There's never been a drug. There's over 350 drug trials for a drug to help Alzheimer's, and there's not, because the reason is that there are multiple different pathways that create the scenario. So in the book, each one, saving your brain, each letter is an acronym for something that's important. Uh, S is for sleep. So we now know, really, when we have sleep disturbance and our sleep pattern changes, that's actually a sign of brain imbalance. That's actually our brain telling us that there's something wrong. And
oh,
when we work on getting the brain working better, the sleep pattern returns to normal.
hmm. Wow, that's exciting and information. We're going to go into that more detail. I forgot to introduce you, so let me do that more appropriately.
Okay.
It's pretty long, ladies and gentlemen, so let's get going. But at least you're going to know you're talking to somebody and listen to somebody that has the skills and expertise and knowledge for 40 years that is telling us some good information. So Dr. Miller is a doctor practicing and teaching for over 40 years. He's an international lecturer. He's down in Tampa, Florida. He's board certified in thermography. He's got acupuncture uh, designation. He's a naturopathic physician. He's a fellow of Brazil's um, Academy, American Academy. He's a fellow of the Aging and Regenerative Medicine. I told you it was pretty long, but we've got somebody who knows what they're talking about. He's a chiropractor, and he's also the author of 5 books. So we are pleased to have him here to give us his time today to teach us. So officially, you're welcome. Okay. Go ahead now. Let me ask you a question.
Okay.
They say on the internet in reliable sources that your eyes are the windows to the risk of you getting dementia someday. That apparently they can do, you look in your eyes and do some scans and something to do with your pupil dilation. Do you know anything about that, or what would you have to say about your brain dementia and finding out if you're going to be getting it or have got it?
Okay. Well, I don't know what research you're referring to on that. That doesn't ring any bells. But
Okay.
um, pupil dilation or contraction is related to what's called the autonomic nervous system, either being which is the fight flight, which is called the sympathetic, or the rest and digest, which is called the parasympathetic. So if we are in fight flight, our pupils will dilate and get bigger, as a general rule. So I would say, and generally, the more we're stressed, the more brain cells we're going to kill. because what happens is when we get under stress and we have adrenaline, we also produce cortisol. And although that is necessary for short-term survival, like we may have to fight off the lion, tiger, or bear, or whatever.
Yeah.
But long term, it actually kills our neurons, and it affects part of the brain called the hippocampus in particular, which takes short term and long term memory. So we have patients coming in and they've had MRIs and different parts of their brain have shrunk significantly.
Okay. So let's get back to your book now, though. So how many points do you have in your book of, sleep was one of them. What other specific
Yes,
topic?
and the A is autonomic balance, which you just kind of touched on with the eye pupil size. So
Like coincidentally. Okay.
so that's yeah. Well, we do something called heart rate variability when we evaluate our patients, and we find in today's world, 4 out of 5 patients, even 9 out of 10 patients, are locked into this fight-flight physiology, and this creates another thing it can cause is high blood sugars because again, cortisol activates. It's called a glucocorticoid, but it activates sugar. So if we get stressed, we have a lot of sugar. V is for vitamins, minerals, antioxidants, and the title Saving Your Brain. So again, there's 2 chapters in the brain about different nutrients that have been found to be helpful in preventing dementia or retaining cognitive function. One of the big ones is like huperzine A. Huperzine A is the drug of choice. It's really not a drug in China for Alzheimer's because it affects 5 different pathways that produce a beta. So a beta is what is accumulating in the brain and the Alzheimer's patients. So N is for neurohormones. So our hormones are very important to our brain function, testosterone, estrogen. G is for genetics. There's a particular gene called the ApoE4 gene that will increase your risk, but it can be negated by taking extra niacin. So again, if you know your weaknesses, there's usually an action step to it. So Y is your belief system. Again, do you perceive things? Are you a glass half full, glass half empty type person? O is for obesity, oxidative stress. U is for unfriendly environment, and that's a huge thing because what we find in Alzheimer's, we have mercury and aluminum in the brain. They're neurotoxic. So one of the things that a beta does, it binds with heavy metals. So that's one of the reasons that if you have aluminum or mercury, then you're going to accumulate a beta in there. So
I
we're trying to
see.
get that out of you. R is for repetitive head injury. B is for blood flow in the brain. R is for reading. A is for activity, exercise. I is for insulin sensitivity or resistance, and then N is for neurotransmitters. So
we need to go through all those. Maybe we can do a couple more of these series, but I think for today, since we're going to try to keep it down to 20 minutes, can you pick out a few of those topics or a couple of them of the ways that we can help ourselves, and let's go into that.
Yeah, let's talk about the big 3. This is about the same time my book came out. The End of Alzheimer's came out by UCLA doctor, and his big 3 is that Alzheimer is a combination. It's a metabolic disease. So again, we're talking about the issue with blood sugar dysregulation. It is a environmental disease. So again, the big 3 with that are mercury, aluminum, and also glyphosates, which are in GMO foods. But a lot of people are accumulating pesticides and herbicides in their body and other petrochemicals. And then the other one is infections. So another purpose for a beta is it's an antibiotic. So so if you have an infection in the brain, you'll form more beta because it's trying to protect your brain. So in Florida, we have a lot of people with mold infections. There's so much mold, because there's so much rain and humidity, and that's a breeding ground. And just on the coronavirus there, if you have reoccurring sinus or upper respiratory infections, you may have a mold infection, and it's a breeding ground for bacteria or virus. So
And so if you get sick, your brain generates more beta, correct?
If you have infection, if you have a bacteria or a virus that gets in the brain, your brain will produce more beta to try to protect the neurons.
Right. But beta is bad for dementia because
yeah, but what we have to look at is that the reason people are getting Alzheimer's is because they have chronic infections that aren't dealt with.
mm-hmm.
They have environmental toxins,
Mm-hmm.
and they have blood sugar issues.
Okay.
So if you correct those things, because you can detoxify environmental things, you can clean up your air and water, and there's different things with glutathione or whatever, you can get the poisons out of your body, because our body can detoxify them if we have the right things to do.
And the GMOs, that would be like lunch meat?
The GMOs are like most all the grains now. Your wheat is GMO, your corn's GMO, and all those things like that. So
more starchy things.
Yeah, they've altered the, like our wheat now changed it. The gluten's different, the protein's different. So you have more susceptibility. But the problem is the glyphosates that is used, that's basically Roundup, has increased 300% over the last 20 years because you have all these super weeds growing up around the GMO foods. So it's kind of like the overuse of antibiotics, and you have strains of antibiotics that are antibiotic resistance. Mm-hmm. So what we're having is these weeds are becoming resistant to the Roundup. So they're using more and more and more. And so
we need to look for non-GMO foods.
Yes.
But since you're just mentioning that, does that mean we need to have non-GMO and go ahead and pay extra for organic so we don't eat the Roundup that was in the dirt?
Yes, absolutely. Yeah.
Or the farmers markets. Like around here, they have tons of farmers markets, 2 or 3 times a week. And I'm sure whoever's watching.
Yeah, it's truly bad. And they're already started lawsuits for non-Hodgkin's on Roundup. It's been proven for that. But just as a thing, it interferes with the absorptions of good minerals and actually enhances the absorptions of toxic heavy metals. Mm-hmm. And so that's not good. It actually kills the good bacteria in your gut and mm-hmm. helps the bad grow. So it's just a bad substance.
Okay, so that definitely no wheat and processed flours and stuff like that. We got to get organic, right? And non-GMO is very important.
Yes, absolutely.
So since we're kind of talking in the food area, I just wanted to bring this up because it's important. I believe you're going to say it's very important because one of them is about vitamins and minerals. So I read online that the 3 top fighting foods to fight against dementia, to not get it are berries, because they're an antioxidant, omega-3, which I guess is a nut, right? And super spices, which they had listed was cinnamon and turmeric.
Yes.
Can you think of anything else that would be real important for us to take that can help ward it off?
Well, yeah, I've got 2 chapters, and I probably have 20 different things, but huperzine A is another big one. So yeah, any of the bioflavonoids are very good for the brain. So there's lots of different things: blueberry, grapeseed extract, and there's lots of nutrients that will have that combination of foods in it. Curcumin has multiple different protective influences for the brain, so that's a very powerful food. Ginkgo biloba is another good food. So yeah, there's a number of them. B12, a lot of people are deficient in B12. They have digestive problems, and so a lot of people need to take B12 sublingually, liposome technology, because then it can go right into the capillaries mm-hmm. in the mouth and go into the bloodstream. Mm-hmm. But D12 deficiency can cause dementia and Alzheimer's.
What can?
B12 deficiency. B12 deficiency.
Oh, really? Okay. Does mm-hmm. vitamin D have anything to do with dementia? That's your bones.
I'm sorry, say again?
Vitamin D, does that have anything?
Yeah, vitamin D is very important.
Okay.
Vitamin D is actually a hormone and it activates multiple genes. When we have off the difference between like when we have a scale, let's just say the scale for most labs is 30 to 100 for vitamin D,
Mm-hmm.
25. So the difference between being in the bottom 25% and the top 25% is 300 or 400% more disease. Okay, more heart disease, more cancer, more
So
diabetes.
what level do we want to be at? Uh,
I recommend my patients 80 to 100.
okay, great. I better
And
go take an extra D pill.
yeah, we like D3, K2. Uh,
Okay, too.
we like a product that's actually out of Fayetteville, Arkansas. Anybody can get it. It's called Biotech, but it's consistently, I have no stake in the company or anything. I don't own it but it's consistently moves my patients' vitamin D levels.
It's
Every
called what again?
The company's called Biotech.
Biotech.
They're in
And it's just
Fayetteville, Arkansas. And we use one of their units called, it's a 10,000 IU vitamin D3, but it also has K2. So both of those have similar properties as they help increase bone tensile strength in
right.
the bone, and they also keep soft tissue from calcifying. So things like bone spurs or plaquing in the arteries, both of those are very important for that.
For those of you, because I know I want to get it, where can we get your book? And if you could please hold it up again, because I want to get the list and some other, definitely some other ideas that you have, because
It's a
we don't
thick
want,
book. So here we go. It's you can get that on Amazon.com. You can get it
okay,
on Kindle. It's also electronic version. You can get it off our website, which is www.savingyourbrain.com, and I'll
okay.
send you an autographed copy of it if you do off our website.
Yeah, absolutely. Uh, so definitely I'm going to get some of the biotech. I know that.
Yeah,
So,
I made a video to all my patients just recently, and that was one of the top three things I recommended
mhm.
for the immune system. Because getting your vitamin D levels up optimally, you activate all these genes that are antiviral.
Okay. So I read online again through many Alzheimer's associations, they say dementia definitely can be reversed. Is that true? I just want to ask the question flat out. What is your opinion?
Absolutely.
Okay.
So our brain, I want you to think our brain is neuroplastic. We used to, when I got out of school 40 years ago, we had the concept that we were only born with so many brain cells and we kind of whittle away at it. I probably did a pretty good job of that in my youth, but we actually know that even if you're 80 or 90 years old, you can regenerate your neurons. Okay. You can create neurogenesis. So that's really what the book is about, is how do we create a state of creating neurogenesis, which is a state that our brain will regenerate and make new and better neurons. But yeah, and our
So can you
brains
think
are,
of one thing that we can do to generate neurons? I know your book's going to give us many, but can you just give us a teaser, would you? One thing we can do to generate more neurons.
well,
Would it
again,
be sleeping more, reading?
sleeping, be, 10 to 2 is your peak healing time. So, if you can get to sleep at 10, we need about 7.5 hours sleep. So sleep is very important. We go through 5 cycles of sleep. So sleep is really, really, really important for brain health. It's really important for our immune system too. Just getting adequate sleep. And
I heard you in your practice use some type of system, brain tap that can help. Can any of those help with helping build
yeah,
neurons?
absolutely. Yeah, absolutely. So one of the things I was going to make a point of is, let's just say we've been a couch potato for 5 years, right? And what do? We'll go get a personal trainer. Has anybody ever done that? I've done that. When I turned 50, I got a personal trainer and I did it for
Right.
like 6 months. So 4 times a week, arm day, chest day, back day, leg day. So what do? We work those muscles repetitively with frequency,
Mm-hmm.
and our muscles got bigger, got better toned, and we burned fat, right? So our brain, think of our brain the same way. When we analyze the brain, we can find the specific weaknesses, and the brain responds for light and sound and vibration. So we can put the right frequencies of light, sound, and vibration in the brain, and the brain will regenerate and the brain will get stronger. And as the more we do that, those pathways get bigger. So this may have started like, like a little spider, like a little tiny web, and it keeps going back and forth and back and forth and back and forth, and it gets thicker and thicker and thicker. So we have a little dirt road, this little neurological pathway, and then we keep putting the right input in, it becomes a 6-lane superhighway. Okay, that's how our brain can be. So it's neuroplastic. We can train the brain specifically. So I saw two 80, one was 87 and one was 85 years old right before we came on today. So they've come in, coming in twice a week. So they have made huge improvement, but at this point they want to maintain, because the biggest thing in the aging brain, this is one point we should make, is our balance and our strength and our core strength,
Mm-hmm.
because that's very critical to stabilizing the lower brain. So if we have this 85-year-olds and they have good core strength and their balance is good, and we specifically work on their executive decision making and keep that sharp, then they're gonna thrive.
So wait a minute, let's get this clear. Your core balance has something to do with your brain
Absolutely,
functioning?
absolutely.
Hmm.
So I want you to think about us. We've all had children or grandchildren, remember, and we look for these different markers. Okay, could they sit up? Are they, first, is they holding their head up? Are
Mm-hmm.
they making eye contact?
Mm-hmm.
Right? Can
Mm-hmm.
they sit by themselves?
Mm-hmm.
Okay. Then are they crawling like army men on their
Yeah.
elbows and knees? Then they
Okay.
get up and they're crawling better, and then they walk. So every
Milestones, I think they call those.
absolutely, and every one of those is related to brain development. Okay.
Okay.
So if something's missed in those milestones, that is a brain development problem. So on the
Um,
other end of the spectrum, we've been talking about the older brain, but with the other epidemic that's in worldwide is ADHD and autism spectrum. And these children all have core strength problems. They have an
oh.
imbalance in their core strength related to the brain development. So in the aging brain, we've had normal core development. When we start losing this, it's the foundation that strengthens our cerebellum. So our cerebellum is the base of brain. That's everything's built on. So if you think of our brain as built like a house,
Mm-hmm.
okay. So first, what we got to have a good foundation, right?
Mm-hmm.
Then we got to have the right walls, because if your foundation's off, it doesn't matter if you're working on the roof.
Mm-mm.
It's not going to be maintained because it's going to sag, right? So likewise, the brain development in our youth, when we were child, baby, is the same brain development in their aging. So all those things are important. We look at those and we go back to the foundation. So a loss of core strength and a loss of balance. So when people and their aging, everybody listening up in their 50s and 60s and 70s, when you're having balance problems, and the sheer fact that you're leaning forward, I'll say this again. The sheer fact that you're leaning forward at the waist or at the head is the sign of dementia. So when you
Mm.
see all these little people and they're bent over, they're having cognitive problems as well. Because the way the brain works on, well, I get it works on our extensor muscles. So if our extensor muscles, that's what's holding us up, right?
Mm-hmm.
Holds us upright. Those become weakened as the frontal cortex gets weaker.
Okay, but preventative then, we can do those corner exercises and all the other things you talked about. Can we?
Superman and Superwoman, side planks, right? Pelvic lifts.
Oh, it's okay. That will help. Mm-hmm. Mm-hmm.
Yeah, yeah. We have 80-year-olds doing those. Yeah, because you never want to be the little old man or little old lady who fallen and can't get up. The reason they can't get up is because they don't have the physical strength to get
Yeah.
their body up.
I guess
So
I'll start my planks up again today.
there you
After
go.
get
That's
off.
what everybody should be doing at home right now, is doing their planks. I'm serious. I put it.
Just a couple minutes a day is okay.
Yeah.
Because
Well,
it's hard to do one, you know.
yeah. Well, you got to start it somewhere.
Yeah.
10 seconds. Now you do fit 20 seconds. Now you do 30 seconds. Now you do 40 seconds. You can, you got to get stronger. But we have when we assess patients, we have 3 different particular core strength tests we do, and that they have to come to this certain margin, and that's part of their treatment.
Right. So core strength is so important because you always hear that a huge amount of elderly people pass away from falling.
That's right. That is the biggest thing. The falling. You have a hip fracture. There's a 25 to 50% mortality rate, but you can fall and hit your head. Yeah, so many hospitalizations and so much disability from falls. So we really work hard in our elderly patients on fall prevention.
Wow, you've given us a lot of information, but this bending over thing is unbelievable. Because see, most people lean a little bit forward, because you think your back is stiff, but it's not true. Probably your core is just weak.
Yes, but it can also be a sign of the front cortex. So if we look at our brain, if we go right above our ears, everything in the front is a motor response, front cortex. Everything in the back is sensory. So we depend on what we hear, what we see, what we feel, what we perceive, feeds information into this part to make the decisions. So if we don't get the right information, if we're not hearing well or we're not seeing well, if we don't get right information on our balance from our feet, then our decision making is going to be off.
Well, our body's like a big organism that heals itself, I guess, right? So we better get busy.
Well, it's just something, I don't think most people perceive that core strength is so important to the brain, but it really is.
So let's just recap a few things and you can add in. So we want to create neurons. We do that by all the things that you talked about, but I guess explicitly keeping our brain going and learning new things, right? Keeping active, that's a big plus.
Sure. Reading is very important.
Okay.
Physical exercise, proper sleep, proper nutrition.
Yeah. We're going to try.
Get your blood sugar stabilization.
Oh, that's another one. Yeah.
Yeah. Check for, so if people will look, when they get their annual physical, they'll get something called a CBC, complete blood cell count. So in there, they have a breakdown of different types of white blood cells. So if their monocytes are over 7, even though that's probably within the reference range, that's usually a sign of a chronic low-grade infection somewhere. So if you have your monocytes are over 7, it could be a chronic urinary tract infection. Okay.
Is there anything in your blood that can detect dementia?
Not specifically. We do that through cognitive testing. So we actually have, we have portals that patients can come in, and we can, or people want to check their cognitive function, and they can go in and check different areas. There's 12 different areas, and you can see. So you're going to be just like you're taking the test, or what the SAT or ACT or what the test we did today. Are you average? Are you below average? Or are you above average? So we don't want to be below average, right? Nobody wants to be below average. So on our cognitive function, that's important. So when we do the testing and we evaluate different parts of the brain, and there's different ways you can do that. For example, if you draw a number on your hand with your eyes closed, okay, and you put, what is that? Okay, and you do both hands. So your inability to be able to recognize that number is a problem in what's called the parietal part of your brain. So if you have anyway, just there's little things that we can check like that in examination. And
so if somebody wants to come to your office, and then we'll get back to the few things that we can do to summarize what we can do to prevent or cure or reverse dementia. If somebody wants to get a hold of you and take these tests and get it analyzed down in Tampa, then they would just go to your website, saveyourbrain.com, right? Save your brain. But if they don't,
savingyourbrain.com.
savingyourbrain.com.
Right. Same as the book. Yeah.
And if they are not in your area, can you refer them to somebody? Can they still email you or call you or get on the website?
We have offices in Kansas City, Tampa, and Naples, Florida, and we have different doctors. I don't know everywhere in the country, but yeah, I know a lot of doctors in different parts of the country that they do something called functional neurology. So this is a assessment of the brain and its function. And one of the things that happens generally in the aging brain is there's a tendency for the left side of the brain, the left hemisphere we call it, tends to weaken as a general rule, more often than not than the right. And that affects mood and also intellect, and can cause, depression as well as cognitive loss. So that's part of the thing in analyzing the brain as balance is actually strengthening. That's part
so
of the
your
therapy.
test will determine if their left side of the brain is getting weaker, or right?
Or the right side, yeah.
Okay. And then if it is, then you're going to tell them to do different things that we've talked about today and a million other things. But then you also might have them do the brain tap therapy, the light and sound therapy to help them.
Yeah, so we do an examination. So we do something called brain mapping, which analyzes brainwave activity. We do something called right eye, which is our eyes are very reflective of brain function. So our ability for us to follow, let's say a train was going by and just following that, or watching a bird fly, that's called pursuits. That is under the control and development of what's called the cerebellum, which is the lower part of our brain. We used to just think that had to do with balance, but now we know it has to do a lot more. It affects our hormone system, our immune system, our digestion, and the ability to move quickly from one to another. That's called a saccade. So that would be like somebody, I always think the clay pigeon, so you're here, and then all of a sudden you've got to move from here quickly and shoot. So all these different evaluations of the eyes and their ability to focus are reflective of different areas of the brain. So we do that. Then we also check the balance in detail. So
if because I'm speaking on behalf of maybe 2 million ladies and gentlemen in other groups as well that will get this interview to help educate them. But I guess one of my questions, since I'm speaking on behalf of them as well, is insurance. If we have a issue and we come to you as a doctor, as a chiropractor, is there any time ever that the insurance will pay for any testing? Just a question.
I personally don't take any insurance. We operate under a private membership association.
But they can go turn it back into their insurance company. They can take the receipts and go turn it in.
Well, they could, but we don't do any insurance.
Process.
And we really, our pricing is like a PPO. So when you're in the private membership health, you get discounts on nutrition, you get discount. Our fees would be like a preferred provider, only you're in our private membership association.
Okay, that makes sense. So it's probably a big discounted amount as well. But I definitely know I'm with Blue Cross, and I definitely know if I came to you and I had an issue, I could submit it to them to try to get payment from them, and sometimes they will pay it. So that's good. So you just don't do the process.
Correct.
Right. So, well, we've learned a lot of things that we need to do to prevent, right? To reverse, prevent dementia. And we can do it. I'd like to delve in more to your book on another time, maybe you'll be able to schedule something in a month or so, and we'll go over
Sure.
another little bit.
Sure. Be happy to.
Helped a lot.
So I'll say one thing about this social isolation is that we need to, we need to be engaged with people in a certain way. We need to smile, if you have this thing, smile at something, because one of the things that's happening, this isolation, is that we're losing empathy and our connection with people. And this is creating neuroplastic changes in our brain. And there's research to show this. So, part of this thing is you want to get in, you can't let the fear to the point. We have to be engaged. We are social beings, and
Right.
we have to be engaged, and you can do it safely. But
yeah, follow the guidelines of your county and your state and your government, but it does make sense to get out and interact. I actually went out today and interacted a little bit, and I feel marvelous.
right. Well, you like to see somebody smile, right? Yeah. So it's kind of scary. But this is all you see in people, I always think of that used to be the bad guys, when I was a kid. Those are the,
Yeah.
in the
Thank
movies.
Robert.
So, yeah. So,
okay. So we know how to reach you. We're happy for all these suggestions you gave us. Let me pick out a couple that I know I'm going to do. I'm going to definitely get your book. I'm going to go do non-GMO and more organic foods. Okay. Although I eat pretty healthy, but those are two things. I'm going to definitely start doing more planks to help my core more.
there you go.
That would be three really good ones for me. And maybe everybody watching can pick just three out and go ahead and make a goal to get those done. I think that'd be
good. It'd be a good start.
Mm-hmm. Okay, well, thanks a lot. Come back again. We'll talk soon to schedule something.
Okay, thanks, Trish.
Okay, thank you. Bye-bye.
Bye-bye.
We're at the end of another enlightening episode of the World Wellness Show, and we want to be reminded of the incredible insights shared by our esteemed doctor. Their passion for health and wellness have provided us with valuable knowledge to enhance our well-being. We offer educational information and suggest strongly that you seek medical attention through your physician or other medical professional. Until next time, thank you for coming.